Thank you for coming. And I hope it'll be of some use for you. I guess it's a self-introduction because I'm so crazy busy that I never sent in my, intro to them. So I'll tell you a little bit about myself. I'm Judy Zocchi. I'm a former caregiver. My husband was originally diagnosed. Notice that that's what we go right to, the brain tumor thing. Forget all the other things you are. But with an oligoganglioma, I still can't say it. It's in 2000, in March, he presented March of 2000. And then he survived for 5.5 years. He had a low grade at the beginning, and then it changed to an aggressive form, sort of 2 years in, a little over 2 years in, and he passed away December 2005. This is a real mission of mine. I feel God gave me the gift to have vision and execute, whatever you might want to call it, or communication skills and those skills, and the gift of the brain tumor. And I say that the gift because as awful as it is at times, many beautiful things come out of the whole experience. Many beautiful things in relationships, in a level you evolve to with your loved one that many times people don't get to in real life, and the people that you never expected to help you, and then the people, when you get to clean house a little, the people that you thought really were your friends, and you realize they're not. So there are many blessings that come for me. As much as I miss my husband tremendously, but the journey is something that I think wound up to be a gift in a pretty large way to other people, because as a result of our experience, we opened the David S. Zocchi Brain Tumor Center at Monmouth Medical Center in Long Branch, New Jersey. So I come here, I don't work there, I just raise the funds for it and run the family programs out of there. Jessie works there, she runs a lot of the family programs. We'll get to that later. It's a comprehensive brain tumor center and a community hospital. I traveled all over the country for the best of the best in every area of what I needed, which I'm sure I know many of you are doing because you're here from Ohio and Pennsylvania and Chicago. So you're on the road again. And I wanted to try to, I was fortunate enough that, I had the income and I owned my own company, so I could be flexible, and we had no children, so we were able to go to wherever the best was for what we needed, but everybody doesn't have that luxury. So as a result of that, and this isn't about the center. If anybody wants to talk about that later, I'd be glad to. This is about you. This is about the caregivers. I want to ask, how many here are caregivers? And how many here are patients? Or survivors, excuse me. Okay, so I have to apologize to you because I'm going to be very blunt about a few things, because this is really about them, and I need to be open and honest about everything. So I'm going to start off with, sure.
If we want to get in touch with you at any time, how do we reach you?
Okay, I will, at the end of this, I'll give you all that contact information, and feel free. But you can always, I have a blog on Brainstorm. Let me just tell you this really quick. Brainstorm, I started this because I'm all about education. You educate yourself to the 10th degree, and you'll make the right decisions for your family. Brainstorm is a dialogue and education series. By the way, at the center, all family programs are free no matter where you're treated. It's not just if you're treated there. That was the condition when I went in there, that if you're diagnosed with a brain tumor, you're entitled to the free services. So one of them is that. They're live seminars that we do on different topics, and then they're professionally videotaped, edited, put online in short bits so that you don't get exhausted watching them, and you can click on whatever topic you want, and you can always reach me through there, but I'm going to give you my personal thing before we leave. Okay, so I always start out with, and my friend here will remember because you give me my endorsement. You said it was really useful for you about the ultimate brain tumor starter kit. And it sounds very juvenile, but it's not. It will save you hours and hours and hours of wasted time. The first thing you need to have is a business card holder. I don't know how far along people are in the journey. How many are at the beginning of the journey, like under a year? Okay. And how many are like Over 2, pretty much. Okay, and you're way. Okay, so, I found that a business card holder, what oftentimes, and we'll get to the team, you know, the team that you're supposed to have put together for yourself, but oftentimes it's, you go from one doctor, you have to get tests sent to another, reports sent to this one. You have to, you know, they have to communicate with each other, and then you have lots of scraps of paper. If you're like me, I'm a complete mess. And then then you can't find anything, and then you have to call this one and say, send this report to this one. If you have a business card holder, when you go to the appointment, you have every one of your doctors already in that little business card holder. You just pull out of your bag or your purse and you show them, and they could take the information. It saves you a million phone calls later on. Before I go to the rest of the kit, I'm just going to tell you that the way I structure this talk is in 3 things. Becoming a brainiac, which is the first thing you need to do. The second is what I call the Caregiver Trilogy. You're the butcher, the baker, the candlestick maker. You're everything now. Okay, and then the third thing is I respectfully disagree, and that is how to make, you know, healthcare choices for you and your loved one together, and be able to say no thank you if it's not what you want, and we'll get to that. So back to the brainiac. Okay, so the business card holder is the first thing. The second thing is, in my day, which was 2000, it was the big MRIs, and during our journey it went to CD. Okay, so if you're a CD, who's a CD MRI person? Okay, anybody still the big MRIs? Which a lot of doctors prefer. Okay, well, if you're the CD MRI, you get a CD holder. Because again, it sounds really, like you don't think of it with this, but you put all of them in immediately in the thing. Because one of the things about progression of tumors, and we'll get to that when we talk about vocabulary and knowing about the tumor and the diagnosis, is that a report that comes from a radiologist, and I'm going to talk to you about the difference between a radiologist and a neuroradiologist, but is a narrative report based on their findings. And sometimes you'll get one from John, sometimes from Larry, sometimes from Betty, different radiologists all the time. You know, different people read different things different ways. When you have all your MRIs together, you know, if there's a question like, how quickly am I progressing or not progressing? An example, we were on a clinical study at the NIH in Washington, and you know, somebody else had told me my husband had progressed to some degree, and I asked the neuroradiologist there, I said, look back on all these MRIs and tell me the rate that you think that he's progressing. Because not just from the last MRI, but from, you know, the 6 before. Look at all of them together. So what you want to do is always arm yourself with all your information. CD holder, chronological order, your MRIs, you have them with you. You say you find out about this like new great doctor that has this cutting edge treatment, and you go there, you know, you have it all with you. Now, if you're a big MRI person, okay, art portfolio cases. Because you know how they slip like out of your arms and they go all over the place? A simple thing like an art portfolio case, it makes it easier to carry them all around. The third thing, and this is the one that it will help you actually determining, you know, if you want to do business with a certain doctor, I feel, is a small tape recorder. You know the little mini tape recorders with the mini tapes? Well, first of all, you've been diagnosed with probably what's perceived to be the worst thing in the world, okay? You're emotionally a wreck, everyone's a wreck, and perhaps the person with the diagnosis isn't even all that with it in cognitive because they just had a grand mal seizure and they're on all kinds of medication and whatever it may be. And there's a whole vocabulary that you don't understand, right? And now you have to make a decision for somebody to cut into your loved one's head and you don't even know what the words mean. So you take the little tape recorder and you ask the doctor if you can record the meeting. And I've never had an experience where anyone said no. And I went to many top docs because my husband was technically inoperable, but we're going to get to that, you know, how inoperable became operable. But nobody ever said no. They never said no. Now, if somebody says no to you, then you might want to think if that's the person that you want to deal with. Okay, and that's a personal choice. And everything I say here is my personal experience. It's not the law, and I'm not telling you to do it, but I'm just kind of giving you options. So, but once you record it, that's not enough, because you can't be then going through a million, tapes. Oh, what did he say, this? So you get someone, you know how everybody's always asking, what can I do? I'll do anything to help you. Well, first of all, you have to actually give them specific things to do. They really do want to help you. But if you say, oh, no, I'm fine, or, and you're getting 6,000 meals, but there's really other things you might need, like this one, you have somebody transcribe the tapes, okay? So my sister, who was a legal secretary, listened to all the things, transcribed the tapes of the 4 top docs we went to, or I think I only had her do 3 because one didn't want to, do anything. She transcribed them, and that's where the 4th thing comes in, which is the binder. And I know that sounds really, really elementary. You need a regular binder, a 3-hole binder. So every piece of paper, every report goes into that binder again, so you can flip through and find out. So you get these tapes transcribed and printed out, and you put them in the binder. Now you can refer concretely. Okay, he said that my husband would lose his speech and, become paralyzed if we did this surgery. He says this, she says this, and you have it all concrete in front of you. And then you start to learn some of the words that are in there that you don't understand. And now, when I originally started this talk, I had 4 things, but I'm now adding a 5th thing. And you can write this down because you don't have that one. It's a memory stick. The flash drive, right? Because technology has changed quite a bit since my day, and a lot more things are becoming available via email. Well, when you have a computer, and it's a little drive that you put in to save information.
Okay.
So it's just another form. It's really tiny, and it's another form of gathering your information. So that's what I call the ultimate brain tumor starter kit. So that's the first thing about becoming a brainiac, is to be equipped. All right. What else now? It's really important to learn the vocabulary. It's so fortunate that the internet exists now. I mean, I think about the people that had diagnosis, of a brain tumor before the internet was what the internet is today. How lost they must have really been to be able to access information. There are so many, like who knows what a pulmonary embolism is? Have you ever heard of a pulmonary embolism? Okay. Now I'm pretty on top of things. Like, I was like the queen of research. But nobody ever told me that a pulmonary embolism was, that people on treatments for a brain tumor have a high risk of a pulmonary embolism. And what that is the blood clots that start in your legs and can travel to your heart, to your brain, whatever. We had an incident where my husband, his legs were purple, and I called. I got a doctor on call, and he basically didn't tell me to do anything. Had I known, I would have taken him for a Doppler. Who knows what a Doppler is? Doppler? Okay, it's like a sonogram. It's an ultrasound, right? Sorry about that. To see if there's actually a clot. Anyway, I didn't know all this, and I didn't know what any of those things were. And next day, my husband was on a respirator for 2 weeks. Was supposed to die. Nobody ever survives. He had a massive pulmonary embolism in his lungs. He had 9 lives. He did recover from that, but point being is, part of learning all this stuff and all these words are crucial, not only for emergencies, but for making decisions, as you go on. So there's not only the vocabulary, all the words that you need to learn, but there is also the lingo, like, your MRI, DNR, NIH, you have all those acronyms and all those letters. Who knows what NIH is? Okay, NIH is the National Institute of Health. That's something you really need to have in your, in your resource. They offer clinical trials a lot that, when all the other ones aren't working, there might be one there. And one did hold my husband off for a while. Okay, that that can, it's the government. It's the government, National Oncology, but that's what NIH is. And you'll hear, they give out grants to lots of doctors, and it's a great resource online, for information. How about MRI? Of course, everyone knows what an MRI is, but do you know what, and here we go to who knows what the dye is called? It's another vocabulary word. Right, okay. You need to know what that, you don't need to know the chemical makeup of that, but you need to know that exists. When you get your MRIs, they'll say with or without contrast, okay, that's a dye. You have to know if you're allergic to that or not, okay. So, it's becoming familiar with those words. And there are a lot of resources, that have those words, but these are things as a caregiver you really have to try to wrap your arms around. My husband and I made a decision that I was going to handle all this stuff, and he was going to focus on, spiritual, his well-being, being healthy, staying positive. He had a lot of life changes going on, so it's up to us a lot to be the one that does that part of it all. DNR, and I'm sorry to have to bring this up, okay? But you're a long-term survivor, so I'm not worried about it. But okay, I know. But DNR is do not resuscitate, okay? And there might be a day that you might be asked that, do you want a DNR or not? So first of all, you have to know what a DNR is. And second of all, that comes when we come to these discussions that need to happen early on in diagnosis. And then you have this all over with, and you can move on with other things. And I'm happy to say I know many people. I know 2 people. We gave another brainstorm, and on that panel were 2 people that were diagnosed, that were in the same support group as my husband, okay, in 2000, and were on my panel teaching other people, one with the same tumor, okay? So what happens to one person doesn't always happen to other. You guys have so much more hope than we had. There's so much more out there. I mean, Avastin and was just starting to happen, in my day. And all these other trials and all these other things that are working, people with GBMs living so much longer. It's really a different world for you. But in my day, there wasn't as much. So anyway, so that's the lingo, all those acronyms, learning about what they are. You have to become a student of all of this, and really a student, and you need to attack that. Okay. Understanding the diagnosis. Now, understanding the diagnosis isn't just knowing the name of the tumor, okay? First of all, you do need to know the name of the tumor, and you need to know that some tumors can be both low grade or they can be high grade, okay? Like my husband's tumor was low grade for quite some time. He had no treatments at first. He had no chemo, no radiation. He had his surgery, walked out walking and talking, which wasn't, people didn't think, many top surgeons wouldn't operate on him because they were afraid it was in the insula brain that that would be a problem. And he walked out walking and talking and didn't need any treatments until he reoccurred a little over 2 years later, and then it came back. It changed. It went to an oligoastrocytoma, which was a more aggressive, and I'm thinking probably went all the way to GBM because of the progression of how quickly things start to deteriorate later on. So understanding the tumor type, there are some tumors that are low grade and stay low grade most of the time, and others that change, and others that have. So when you're looking at treatments, you have to know if a clinical trial only is for newly diagnosed GBMs, then you need to know that, and you have a astrocytoma, that's not the trial you're supposed to be in. So learn about your tumor, but also about the location. Where the tumor is located is a whole nother ball of wax, okay? First of all, you can have, and there's a big movement about not using the word benign. A lot of people don't like to use the word benign because people misunderstand it and think that it's not dangerous. But because it's the brain, and our brain controls all of our executive functions, even something that is not cancerous at the time, okay, can it can kill someone, and it can hurt, and it can really screw their lives up. So the location means a difference. In my husband's case, the location effect, it was on his left side, which means it affected his right side. It's opposite. And my husband was right-handed. Okay, and it was in the temporal and frontal lobes, both lobes, so it could affect his motor and his speaking. He became very aphasic, which means you know what you want to say, but you can't say it. It affects your speech. Knowing that location, when people have changes in ability or in personality, some people have had drastic changes. I never experienced, because it wasn't in that part of the brain, a change in personality or who he was at the core of himself. But I know other people whose loved one completely became a different person, and you know, they were like, who is this person? Then there's other things that depending on the location could be affected, like impulse control. And this is something later on when my husband's tumor progressed that we did experience, but where I'd say, Dave, you know, you can't just jump up without asking, without one of us there to spot you. He was paralyzed on one side. He was half paralyzed. But if he wanted to get up and go over to the door, he'd just pop up, push himself up. And it's because he lost the impulse control. And the way that we know that is that we had a neuropsychological exam. And when I get to the team later, one of the people on your team should be a neuropsychologist. And what they do is they test you. It's often really good to have that test before you have brain surgery, after you have brain surgery. It locates, it tells you what's being affected in your brain. You know, and that was one of the things that was identified for us, was the impulse control. And that was an example of how it was actually manifested. So you know, you're learning science. I was a fine arts major, and I had to learn all this. So if I could do it, so, you know, so can all of you. And you also need to understand the treatments and the side effects. And I'm gonna get to that in a minute. And the institutional philosophies. I just wanted to mention that in this, but it's going to come under the second section, which is the Caregiver Trilogy, where you know, wear a million hats. So, does anyone have any questions before we go any further about the first part?
Is the neuropsychologist usually covered under health insurance?
Now, you know, with everything that's changing, I don't know, but if the doctor, generally, if the doctor, you know, says you need a neuropsych exam, you know, ours was. I can't speak for everyone's insurance or the way things are going these days. Has anyone else had experience?
Ours was covered.
Yours was covered? Okay, yours was covered too. So.
If the doctor doesn't suggest that you need one, then
Well,
you
suggest to
need
your doctor to suggest that you need one. You really should have one.
one? Okay.
Okay.
You can ask and say, I need one, please.
Right. Like, you know, you could say we're having all these troubles. We need to kind of, you know, because there are, like the medical director, you know, that I know. Okay, there are some doctors who, you know, don't think it's a big thing. I mean, I have had doctors that do think it is and that don't think it is. But I'm telling you, okay, it makes a huge difference. Okay, to know what you're dealing with, you know, and you need to look for, and when we're going to get to the team in a second, you need to look for people that specialize in cognitive testing and brain tumors too. Because a speech therapist, well, I'm going to get to this in more depth, but a speech therapist that treats children with lisp are much different than a speech therapist that treats cognitive speech problems that come from the brain. Okay, cognitive. It's apples and oranges. And you know, we're going to get more on that in a minute.
In cognitive what?
Like if you're going to a rehab of some sort,
Right.
you need to make sure that they have a specialty in cognitive rehab. That, you know, if you have a broken leg and you go to rehab, they rehab your leg.
Right.
If you have a brain tumor and you can't walk, there's nothing wrong with your leg. It's because the brain function to get the message to the leg isn't working. So when you're choosing that rehab, you need to choose one that's not a heart and orthopedic rehab, but one that has some sort of especially, and generally, you know, they might be the same people that also deal with stroke or other brain injury and that kind of a thing. Any other questions before I go on to the next section? Is this making sense? Or okay. So now this is my favorite section. You're the butcher, the baker, the candlestick maker. So you at one time had X amount of duties in your household, and then if it's a spouse or a partner or whatever, they had other X amount of duties, or if it's a parent, you know, they like advised you most of your life. Okay, so everyone had their roles, and they had their set of things that they did within their roles. So then you also may have a career. So you have your duties in the household that keep your family life running, and then you have your career. You know, whatever your work is, your own personal life going, and he or she has theirs. So now you get it all. Okay, so you now are you do everything you did, and depending on where you are, you know, like when we first started out, you know, Dave was still able to do a lot that he could do, but you know what? He had a seizure. He couldn't drive. So when Dave was able to go to work, okay, I'd drive him an hour and a half there, leave him there, drive an hour and a half back, then drive an hour and a half back to pick him up, and drive an hour back. So now I'm a chauffeur, okay? You know, on top of it all. And then, you know, he used to immaculately do all the bills. I mean, he was really organized. Like we were Felix and Oscar, and guess who was the Oscar, okay? So he used to do all the bills and you know, meticulously, and then one day, all of a sudden, that stopped. And now I'm doing that, okay? And then, so, you know, I'm just talking about things that you don't even think about, that, you know, someone else is doing, that's carrying the load in your house, and now you're doing it all. And if you have children, that's a whole nother dimension to it all. But aside from doing everything he did, everything you did, your job, whether it's homemaker, parent, professional, whatever it is, now you're also doing all the medical stuff on top of it all, okay? So you are wearing like many, many, many hats. And that's why I'm going to try to organize some of those ideas and those thoughts and things maybe you need to look in that will help maybe make it a little clearer and easier. The first thing you have to do is build your team. Now, some of you might be in other parts of the journey, but may have not realized that there's one of these team members that would be helpful. You know, certain ones I didn't discover until way into it. But I'm going to give you the base team and then the auxiliary team. Your first team, and it's my personal belief that the neuro-oncologist is the captain of the ship. Now, I'm not saying that you agree with everything that the neuro-oncologist wants to do or whatever, but what I'm saying is that normally surgeons operate and then you leave, except for when you go to get your you know, follow-up from the surgery and all that kind of thing, and then the follow-up stops, okay? But a neuro-oncologist deals with other things besides, let me define a neuro-oncologist first. First of all, how many of you have a neuro-oncologist? Okay. How many of you have a medical oncologist? Had. Okay. How many of you have a neurologist? Okay. So a neuro-oncologist or a neurologist?
Neurologist.
Okay. All right. Now, what do you guys have? Because you didn't raise your hand for any of them. A neuro-oncologist. Okay. Okay. So let me just define all this for you. A neurologist is a doctor who specializes, you know, in the brain and can handle many things, like everything from, you know, epilepsy to MS, you know, anything that has to do with the brain structure, whatever. A medical oncologist, a regular oncologist, is a person that deals with cancer, okay, any kind of cancer, generally. A neuro-oncologist is a person that is specially trained to deal with brain tumors and brain cancer. He's a neurologist with an oncologist double. They're like a double major, okay? This is the person you need to be dealing with because they understand it. They understand everything that comes along with the brain tumor, whether it's cancerous or not, and is able to kind of detect if perhaps it's turning to cancer because he also has that cancer portion of it. Or if it already is brain cancer, like a GBM, a higher grade tumor, they know how to handle it. And they're up to date with all of the trials and things that are for people with brain tumors and brain cancer. So,
We forgot one thing.
what?
We went from a neuro-oncologist to a neuro-epileptologist.
Okay, he's on my list, but we didn't get to that. But no, and that's a really great point. A neuro-oncologist can deal with seizures, you know, but if you're having real seizure issues, if you remember, we did, okay, we then went to a neuro, you know, to an epileptologist, a person whose specialty is seizures in addition, okay? But you still should have the home base of a neuro-oncologist.
Have you ever seen where somebody goes from like a neuro-oncologist to just being seen by a medical oncologist?
Can I tell you that I did that and I feel like I made a mistake? No, I really do.
And if you're not getting the support that you want from the neuro-oncologist, you feel maybe a local oncologist would be more supportive of the treatments you want to pursue?
Well, you have to go with who your family's most comfortable with. If you make that choice, it's not a bad thing to make that choice, but if you do make that choice, see, for me, my husband's neuro-oncologist was in New York, okay, and he couldn't travel there anymore at that point, and so I went to a regular medical oncologist, okay, but he treated everything, and it wasn't until then a neuro-oncologist came into the area. Dr. Ravel, who's the medical director of the Brain Tumor Center, came from Sloan to the area, and I only went to him because I needed a local person to monitor me on a clinic, a neuro-oncologist, and then realized how good he was. But there were things that should have been watched for that somebody with a limited knowledge of brain tumors doesn't always see coming ahead of time.
But could you mitigate that by getting like second, third, fourth opinions? You know, you get the scans and you send them out to other.
Oh, absolutely, absolutely. And you know, you're educating yourself. So it's okay because you know what you're supposed to be looking for or whatever. The chemo can be administered anywhere, or if it's chemo or whatever. But as long as you know everything that's going on and you send the scans out, you know, just say this is what we're doing. Do you agree with this? That's absolutely okay. Anything's okay. I'm just giving you like sort of, if you can't find a neuro-oncologist that you like and that's in your area, then you do need to go to a medical oncologist and get outside support like you're getting. So, and then in the case even with a neuro-oncologist, there's somebody else who might be better in seizure control, you know, that you add to your team. And then they have to work, so that's where that business card holder comes in handy, you know, and then you add to your team. So then you have a neurosurgeon if you're going to have surgery. And here's the questions you need to ask the neurosurgeon. First of all, are you a brain surgeon or do you do backs and necks and everything else? Okay. So one of the important questions is how many brain surgeries do you do? So if somebody does 1 or 2 brain surgeries a month, as opposed to somebody who does them every day or a large amount of them, that's an important information for you to know. Now, I'm not saying a neurosurgeon that doesn't do a lot of them for whatever your type of tumor is might not be a better choice for you because maybe you can't travel, maybe you don't want to, maybe they are an awesome, awesome surgeon. I'm just saying optimally, these are the questions that you ask. Okay? But not only do you ask the question, how many brain surgeries do you do a month? You go a step further. How many of this type of tumor have you done? You know, what have your results been? Here's the big question. Okay, and especially in my case, my husband had a tumor in the insula of the brain, which it was pretty much deemed inoperable by even most of the top surgeons. There were a few that were doing insula tumors. Okay, I asked I went to, and these are really good surgeons, okay, and I asked one of them, how many have you done in the insula of the brain? He said 12. I said, what's your complication rate? He wouldn't tell me, okay? Now, of course there's going to be complications in brain surgery sometimes. I'm not to think that I'm going to find someone 100% and that's it, except the doctor on The Gifted Man, okay, the new show. But then the other one, I said, how many of these have you done? He said 40. I said, how many complications did you have? He said 4, and I don't know what happened. It was an honest answer. To me, it was a good percentage for what we were going through. Then he made a phone call, and we went right over to the hospital and met with a girl who had the exact same tumor in the exact same location that he just did the surgery to, who was sitting up eating her breakfast. And she came in from Portugal for that. Turns out that's not who we had surgery with, because when he was on the operating table, the surgeon said, I can't, something was bothering him. He had done all the pre-testing. And when I get to hospitals, you're going to see why picking the right hospital is important. And he realized Dave only had one drainage vein, where most people had 3 or 4. And that put the surgery even through the roof more of risk. And he said, you know, there's only one man in the world that can do this. And he sent us to Ghazi Azargil, who at that time was 75 years old and he was neurosurgeon of the century and did my husband's surgery. He walked out without a deficit. But that was from learning all of this and asking all of these questions, because 2 other top surgeons, and all these surgeons I would recommend for brain surgery. It's like, I'm not saying that any of them were bad surgeons, but I'm talking about our case. The first 2 wouldn't even operate. They said no way. So, you know, that's why all these questions and all this information and learning about this is so important. So the other question is, well, we'll get to hospitals later, but those are some of the key questions to ask the neurosurgeon.
I have a comment,
Sure.
though. I mean, that's all well and good, but usually you're going so fast and you have to make these decisions. You don't have time to go research another, you know what I mean? You're stuck in, like, you need surgery tomorrow. That's pretty much what they're telling you. And you don't have a chance in a lot of cases.
And that might happen in a lot of cases, but I do know a lot of people who've been told you have to have surgery tomorrow. But it's different on the emergency, in an emergency case. Then you need to do what you need to do. And you need to have confidence in who the surgeon is that you are. And at least you can ask some of those questions of the surgeons that are in the hospital that they're telling you have to have surgery with. You know, you can't always shop around. But I have to say a large amount of people can, like, because it isn't an emergency. But in an emergency situation, that changes everything. You know, I'm just giving, like, sort of the best of all worlds, and that, you know, is that a situation that you had to handle, or how did you?
It just was, everything had to be done quickly.
Right.
I wouldn't say emergency,
Right.
but they were telling us, saying you need the biopsy done now, and
Right.
his was inoperable as well.
Right.
And we sent it around the country, though, quickly, because we
Right.
had a few days.
Right.
But then we had to schedule it, and we did, you know, I look back thinking, gosh, could I have done something different? You know, could I have found a surgeon that would have touched it? It was motor strip, and,
Right.
you know, I sent it to Berger, some of the best in the country, supposedly.
But you did send it to good people.
Right.
Yeah.
And everybody came back inoperable.
Right.
But
How
I
long
found
ago was that, too?
That was 08. I mean, he's doing great.
Right.
Still. It's
So
still
it was the
sitting there.
right decision for you guys.
Yeah, but you still wonder if you could have found somebody to take it out, because you know that's the best,
Right.
obviously.
Right. Well, you know, in my case, I was able to, but and that was all done in a short amount of time. That was all done in days, like all those appointments. It's like, well, I have a lot of tenacity. I mean, you know, and we're going to get to that I respectfully disagree kind of thing, you know, but everybody's different. And you know what, it's still not too late to show the films or whatever, you know, if you need to at this point, or even now in case you need to,
Right.
you know. But it's again, I said this at the beginning, this was my journey, and everybody's is different, but you did the right thing in sending it around, you know. So okay, neuroradiologist. Okay, so looking wherever you're getting your MRIs, and their MRIs are being read, needs to have a neuroradiologist. A radiologist is a person that reads x-rays, and they read, again, all kinds of x-rays. A neuroradiologist specializes in reading the x-rays of the brain, okay? So that's, you know, you need to find an MRI facility that the reports are being read by a neuroradiologist, if you can.
Is that a safe assumption if you're at a major cancer center, they're being read by a radiologist?
If they have if they have a big brain tumor-like section, maybe. I don't know, but it's an easy question to ask.
Or can you tell by the report who it's signed off by?
Oh, you can get their name, and you can go right on the internet and look up their bio. And you can just take the ones that you have already, you know, and if they haven't been neuroradiologists, and our center's at a community hospital, and we're blessed that we actually have a neuroradiologist. You know, I would think a major cancer center would, but I don't know that for sure. And interesting enough, our neuroradiologist actually lost his mother to a GBM, so his commitment to it, that's why he became a neuroradiologist. So it's an awesome story. Okay, so we already talked about the neuropsychologist, and I mean subspecialties, and we talked about cognitive rehab. I wish I had thought to get my husband after the first surgery, even though he came out walking and talking. There were some little things that could have like improved his life with some, you know, little memory things or whatever, and I didn't really know about the cognitive rehab then. And I think that the cognitive rehab earlier on for Dave would have made a huge difference, you know, for his overall progression, although he did really well. But later on, he needed cognitive rehab major, and even if it's only to teach you how to get rid of your frustrations if you can't talk, to how to communicate in other ways, you know, it's not necessarily that it's going to cure you, but it could help you have a better quality of life. I had one friend with a tumor who, you know, he had big short-term memory issues left, and so he used to make lists, and then he'd forget where he put his list. So he pinned it to the outside of his pants, and then he already knew where his list was to go over the list. So a good cognitive rehab person, they can teach you those kinds of things, you know, that will make your life easier for you.
Now, is it, because what you're talking about, I can't say the word, you just said, I'm bad with words. But when we lived in Houston, MD Anderson,
Right.
They did those to Tanya once a year. And then we moved back to Cleveland area. We go to university, they don't have them.
Well, are you talking about the neuropsychologist or the cognitive rehab?
The cognitive, they don't do it at all. She hasn't had one. That, like you said, that tells you a lot. It's been 8 years since, but they don't have.
Okay, there's two separate things. A neuropsych exam is a test. It happens once.
Okay.
Cognitive rehab is sort of the treatment of where those deficits are. It's like, it could be occupational therapist, physical therapist, speech therapist, all with a cognitive background.
I don't know which one, what they did, the lady would talk to Tanya, tell her 3 words, go way down the road and come back, see what's those.
So that was the test. She was being tested.
And where she had to put, how fast she could put squares and squares, blocks and blocks.
Right, that's a neuropsychological exam. Okay, not the rehab.
Okay.
The rehab is ongoing every week or whatever to make whatever.
Okay.
But you know what? There's out there is a sheet from the brain tumor. It has purple, and from the neuropsychology, you know, a whole bunch of organizations dealing with that. There could be I'm sure there's an individual practice somewhere in town, you know, just because that place doesn't have it. And we're going to get to institutional philosophy soon about where you don't have to stay for everything in one place, you know, and so I'm sure you can find that in your town. But there's a resource out there. Okay. I saw it. It's purple. Okay, part of the rest of the team, I'll run through them quickly so I can get to the other. Endocrinologist. If you're on steroids a lot, oftentimes diabetes happens. I was giving my husband injections, you know, down the line there. And so, you know, you might have to have I'm not saying run out and get one now. I'm just saying if you're starting to if you're on excessive steroids and somebody's peeing a lot, you know, it's a sign of diabetes. And, you know, you have to check the sugar and if you develop diabetes, then that's somebody you need to see for that. And then psychiatrists or psychologists, depending on some people, because of where it is in their brain, they might be depressed. I mean, clinically depressed, not, oh, wow, I have a brain tumor, upset, but a clinically, physiological depression. So you might need, those kinds of medications. Psychologist, or a licensed social worker. I mean, there's a lot. Your life changes. If you're a couple, your roles change. Everything changes. Your life changed on a dime. So then you have to adjust to the new whatever it is. And it's not always bad. Like but support on maybe how to reorganize your life a little bit. What to leave out, what to keep in, who's going to do what. What was really important for me, and I'm going to pass on to you, is making sure that your loved one can maintain their dignity of being an equal. It's very, when you take care of somebody, you can become their mother or their father instead of their spouse or their child or whatever. Roles reverse. It's very easy to include them in decisions. Well, they should always be included in the decisions, but even if they don't want to be, it's very easy, even if you're really making it, to say, hey, you know what, this is what I was thinking. Here are the options. I would write things down when my husband had the aphasia in big print, and, so that he could see it and just not be demeaned to the point where he didn't matter. What he's saying and what he's doing doesn't matter, because like you said, you have to do it all so fast, that you need to keep all that in mind. And then, what we already talked about, the epilepsy, that, if you have a real seizure problem, some people present with a seizure and never have another one again. Other people continue.
So, what time was close to up?
Oh, okay. Wow. All right. Let me just run. Okay. I'm going to give you my email too, and you can email me. But I'm going to run real quick through these things. Institutional philosophy. Okay, and that is knowing what your institution's philosophy is on. For instance, one hospital we were at didn't believe in Gamma Knife. Another hospital believed in Gamma Knife. They were both equally as awesome top hospitals, but had different ways of going about things. You need to learn about them all and make the decision that's right for you guys. Medications, knowing the difference between necrosis, swelling, and tumor growth. They all look the same. Okay, so you need to just don't assume the tumor grew. It could just be swelling. Okay, or it could be dead tissue, and they talked about some of the, the ways out there, the PET scans and the things like that. Finding your hospital. If you're looking around for where you want to have brain surgery, try to go to somewhere that has a tumor board. A tumor board is a conference, okay, where the neuro-oncologist, the neuroradiologist, and the neurosurgeon, the radiation oncologist, oh, that's part of your team, I forgot to say that, the radiation oncologist, they all meet and go over cases together, okay? And they make joint decisions on what they think the best thing, not them all operating separately. That's really important to look for. Looking for a neuro ICU in the hospital. That's an ICU that knows how to take care of neuro patients, not just a general one. But it might be better for you to stay close to home and forego that if you think they have good nursing. Again, that's all personal choices, but if you can have everything, a neuro ICU would be great. And then the technology, of course, and the calibration of equipment. So there's certain equipment that if it's not calibrated, if they're back room, like radiation, okay, has to have an adequate team of physicists and whatnot in order to and the machines to be calibrated to do it right. You need to try to ask those questions when you're in that form of treatment. And now I guess I have to rush. I feel really bad that I have to rush on this, but anybody can call me or email me best if you have any questions. And you can go on. I do this talk. It's on video, not quite so rushed. On brainstormseries.org. If you take one of these flyers, the website, and then my name is Judy Zocchi, you go down to the caregivers one, and you can watch the different sections. They're labeled on what they are. But here's what I want to end with, and this is really, really, really important.
Which one did you say?
Brainstormseries.org. It's on this flyer, and so that you can take that.
They're by the front desk if you want.
Yeah, I brought some in here too. Is that now the third section? I respectfully disagree, and I'm going to run through this. And but maybe I'll run through it. Okay, here it is. Okay, you have to have confidence in your choices. Okay, they're your choices. You've picked what you felt was best for your family, and you need to have confidence in that. And you need to trust yourself. As long as you make those choices out of an educated point of view, you know, not when you're in crisis and you can't, but when you can, and you work as a team. And if you can't, have someone mediate for you. You know, if you need to. But remember this: you have the right to question. You have the right to question your doctors. You know, you have the right to disagree with them. Okay, and you have the right to hire and fire. And if there's the most important thing you can leave here with knowing is you are the employer. People forget that they hire the doctor. They pay the doctor. You don't have to accept things you don't want to accept. You can fire that doctor and find one that you want to work with. You shop around for a car, okay? You know, shop around for who's best for you when you can. So I want to let you know that we offer a lot of free programs no matter where you're treated. We have a camp for kids whose parents are diagnosed with a brain tumor or died of a brain tumor or brain tumor survivors. All this is free of charge. We have the education series. It's online if you live far away. You know, whatever support that you might need, that information is here. And I will leave I'll give you my email right now. This is my personal email. You can always get through to like Jessie or any of the other staff, Nancy that's here. But my personal email is JM as in Mary, Z as in zebra, O C C cat HI at AOL.com. And I'm happy to guide you wherever you need to go.
Just ask you, was your husband Dave, did he feel as if he was living for doctors, being that we went through that whole team of doctors?
I think that he tolerated it for me, dragging him around. I mean, he knew it was, like, intellectually it was the best thing. The opinions, always get 3 opinions if you can. We're done, okay, thank you.